Hi, I'm Shayne, and thanks for joining us. I'm here today to help others navigate the journey of dealing with a loved one, a parent, or a family member who's aging or dealing with Alzheimer's or living with Alzheimer's. As many of you know, my mother was diagnosed with early onset Alzheimer's at the age of 69, and for the last 6 years has been living and thriving with Alzheimer's. Over the last 6 years, I have learned so much. I have met some amazing people. I've found some amazing resources, and I want to share them with you so that if my journey can help someone else, I feel I've done some good in this world. So today I am here with Carole Hirsch from Prepare to Care Emergency Companions. Thank you so much for joining us today, Carole.
Hi.
Carole, can you tell us a little bit about yourself and about Prepare to Care?
Sure. I moved here in 94 and moved in with my grandma. I moved to Florida in 94. I moved in with my grandma. And I took care of my grandma, my Uncle Joe, my Uncle Max, and my mom with dementia. And I really understood that there was some missing links in care for the elderly and the frail. And I would see people going to the hospital and by themselves. And that for me was very upsetting. And I also wasn't able to hear my grandma's request to be made comfortable, that would be the most dignified thing that I could do, and continued on the journey, the medical journey. And when everything was said and done, I wish I would have listened to her. So I started my business called Prepare to Care Emergency Companions for two things. One, so that we could have these discussions about dignity when somebody's not sick, and to also make sure that nobody goes to the hospital alone. Since that time, I have realized that there's no one roadmap to aging, that every family has a different bump in the road. I have tons of experience in working with the elderly and the frail, and people pay me to help them get on road again. And so that's kind of my little story. That's a little bit about me. Do you want to take a little break, or should I just keep going
No,
with what I do?
please keep going, because I think it's so important. I think that so many of us don't have these important conversations with our loved ones or our parents until it's too late. And I think that your niche of being that hospital advocate for someone is so thoughtful and needed. So continue, please.
Okay. And I would say that, really my business is to encourage safety, peace of mind, dignity in the aging process. On a practical level, what that means is that I can help assess care needs and develop a care plan. I can, this is especially important if you are a loved one caring for somebody with cognitive impairment. You're likely to be stressed, you're likely to end up in the hospital, you need to have a plan in place. I'm an expert in interpreting long-term care policies and making sure that people get either on claim or don't go on claim if it's not the right time. I help arrange for legal and financial services. Sometimes you need care and you don't know how you're going to pay for it. I help coordinate medical information. If a senior goes into the hospital, they may be taking a pill. They have no idea why they're taking it. They are so vulnerable to being misseen for what is normal without having been made prepared before they have a medical crisis. And kids don't even know what their parents are taking, so they're useless as well. So that whole prepared part is just really valuable. I can serve as a sounding board to make sure that you get the information that you need so that you are getting the care that you prefer. And I would say that what's really important when you consider an advocate or selecting an outside resource to help you navigate what you can do to make this process be one of safety, security, dignity, is to make sure that your advocate is transparent, holds a fiduciary responsibility, and that you feel safe and respected, because not everybody wants the same thing, and you have a right to have your needs met. And And that's kind of the basics of what I do, which is kind of a lot.
It is a lot. And you brought up a lot of things that people might not consider, especially today. We're down here in South Florida, and a lot of the adult children may not be living nearby. They may be out of state, or even if they are in state, they may not know what medications their parents are on, what doctors they're seeing. They might never have even had a conversation about, their end of life care and what they want. So I think, would you say that that's the first step, is really sitting down with, whether it's a parent, a spouse, a loved one, and starting these conversations? Would that really be the first step?
From my perspective, the first step is realizing that you can benefit from help, right?
Mm-hmm.
I think that so many children don't really see where their parents are at because they don't want to see where their parents are at. So I think, I think it's kind of, you have to take the blinders off and really see that you could benefit from help. I would say that one of the big things that I do is that I'm a communications expert. I can sometimes mediate the situation where, many elderly people, most people, when they are realizing that they have needs, they become more wanting to be in control, which makes it harder for parents to step in. For kids to step in and help their parents. And so to switch the dialogue from control to legacy and to mediate that, I think sometimes you really need a third party to do that.
Right. I will say that when my mother's needs grew, that was one of the hardest things. As I took on more responsibility, she fought it because she felt like she was giving up control. And walking that fine line of really helping and stepping in and taking over, but not stepping on her toes, and really letting her be a part of the process, letting her be heard, really helped, at least for us to navigate. And it was difficult because it's a mother-daughter relationship, so that's hard to begin with. But making sure that she was still heard, and that she didn't feel like all of her decision-making was being taken away.
Yeah, so that's a lot of how I switch that dialogue, is to first have people understand the need for control, where that comes from, and then to switch it to talk about her legacy and to talk about it in positive communications. Mom, rather than say, don't worry, just a simple thing of, Mom, I just want you to feel secure.
Right.
And, whoa, that's a whole different feeling, because it's just a positive approach to communication. So sometimes people don't realize that they can really benefit from just a little perspective, Right.
And being that advocate for someone, being the person who's able to step in, whether they're taken to the hospital or just dealing with a doctor, and being able to say, well, this isn't what they're comfortable with. Being that third party is sometimes easier than a child or a spouse being able to do that.
Sometimes it's easier, and then just also just the level of experience. When somebody's confused, I can guess that it's some kind of UTI or some kind of infection. Where as a kid, you don't, this has never happened to your dad before or your mom before.
Right.
What's going on? Like, are they demented? Are they, so yeah, just sometimes the extra information just really makes a difference.
Right. And one other thing that you mentioned that was so important was being able to interpret and really read and understand their long-term care plan. When someone's on, whether it's long-term care health insurance or long-term care plan, being able to read it and say, okay, these are the services that are available to you, and this is what we should tap into and use, or maybe let's save that one for later. A lot of people don't realize they may be paying out of pocket for services they don't need to, that may be covered.
Yeah. And some policy, every policy, long-term care policies, there's not one that is the same. And so, it really is take somebody who's gone through a lot of mistakes with long-term care policies to make sure that you're not losing money, that you're taking advantage of everything that's available. Also being denied a claim because you just didn't realize what they were looking for. That kind of stuff can just make all the difference in the world. And yeah, sometimes anyway, I could go on about long-term care policies. I'm not going to do it.
But it takes an experienced eye.
It really takes an experienced person with long-term care policies, because they can be very tricky, and you could be not taking advantage of or utilizing services when it's not the right time. Absolutely.
Right.
And then again, yeah, being denied for a claim, which is so unfair when you totally are entitled to that care.
Right. And Carole, how do your clients, who is it that usually kind of finds you or comes to you first? Is it usually the individual? Do they come to you through a care manager?
So I do, like you, I do a lot of work with clients with dementia. So I have a lot of doctors that give out my name. Mm-hmm. And then it's usually the kids that call because their parents are not really capable of making those calls. Mm-hmm. So I get majority of my new starts come from the children who are organizing everything. Mm-hmm. But being this special niche that I have of wanting to make sure that people's advanced directives get honored, there are surprisingly a number of people who are in their 90s, who are widowed, who are totally, completely in their right mind, and absolutely want to figure out every angle to make sure that they can still continue living as long as they are, as long as it's dignified for them. They don't, so I do have a certain number of elderly, frail, or just elderly, not frail people that call me so that, I can help their children in a crisis situation, honor their wishes.
Mm-hmm. Wonderful.
Yeah. I have some great clients, in all honesty. I really love what I do. And I'm very, very lucky.
Your passion and your knowledge radiates from you. So you can really tell. And I've known you, Carole, now for a number of years. And just being in your presence, you can feel the passion and the compassion that comes from you.
Thank you.
I will say that. Tell me a little bit how COVID-19 and the current health pandemic has kind of affected your business.
It's changed my business like almost 90%, because I have probably 100 people that are on call in case they have a medical emergency, to meet them in the emergency room and get them through the transitions of care. But not possible, just not possible. So people still pay me because I can still walk them through the discharge process. But, a discharge when you haven't gone in to see the patient is a whole different ball of wax. Mm-hmm. Patients that I used to visit and do medication management or just check on their toe or whatever, that are living in any kind of congregate setting, I can't see them. I'm totally reliant on other people to do this kind of checking in. And it's not effective. It's not, I mean, they can't take pictures. It's not allowed. To see somebody through a window, it's just like, oh my God, I'd rather just so hard. Yeah. So, I mean, my business has been transformed, besides the fact that my heart aches for people that now are living in senior prisons. And I'm sorry for all the people that run assisted livings, because I know that, many of my people feel very cared for, and they feel very safe that they are where they are at. So, but for me, it's just really, it's challenging. But, and I have developed like my own little protocol after doing a bunch of research on, there are people that are still living at home, and I do get to visit them. And I do have a protocol for how I can safely enter somebody's house. So those are things that have developed since COVID-19. And, it's just, it's a challenging time. It is.
Yeah, it's changed a lot. I know personally, my parents are in a assisted living facility, and the facility was on complete lockdown, and still is since the middle of March. And other than, thank God for FaceTime and Zoom and things like that. And again, relying on the healthcare workers that are able to enter. They've really been my eyes and ears. And I know that's difficult. It's difficult for people on the inside. It's difficult for us family members on the outside. And we are relying on, the healthcare workers at this point to really keep an extra eye because we're not in there as often as we are. So I think that.
I'm glad I have a good phone voice.
Right. Yes. 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 Well, before meeting you, Karen, and I said again, I've known you for years. I had kind of never thought about that, needing someone, we have so many elderly down here that don't have family in South Florida, and really someone to be that advocate should your loved one need to go to the hospital for any reason, even before COVID, having that person that could really help almost like translate and be that advocate between the patient and the doctors and what's going on, and also be the liaison to the caregivers who may not be locally. I think when I heard of it, it was an amazing service that I think a lot of people are not aware exists. How do most people find you other than, so I think we talked about the doctors and we talked about some of the facilities.
The only other, I don't really do any advertising because
Right.
I'm busy enough.
You're mostly referral based.
Referral based,
right.
people, yeah. But I do pay for one form of advertising, which is I am a part of an organization that promotes patient advocacy as a professional field.
Awesome.
And so I'm a member of the Alliance of Professional Healthcare Advocates, and I pay for a little blurb on their page and then their directory. So sometimes I get phone calls from the internet from that. And of course I have a website because I'm dealing with people outside of Florida and they just need the legitimacy of seeing that I have a website and that I'm real. But really, I have been doing work in this county since 2009, working with the elderly and the frail. And, I have a solid reputation. And my phone rings all the time. That's how, I don't know how people find me, but.
Well, if anyone is out there and you have a loved one here in South Florida, whether you're local or not, whether you need a care manager, an advocate, someone to help you navigate any of the things that we have discussed, whether it's a loved one going into the hospital, whether it's a long-term care plan, whether it's someone just to help you keep it all organized or just start those conversations, please reach out to me. I am going to post here with this interview Carole's contact information and my information. I would be more than happy to put you in contact with Carole. I will tell you from knowing her personally and professionally, her compassion, her professionalism, and her passion for what she does, you will never find a more caring, kind heart.
Oh, thank you. And I will say that if somebody wants just to organize the information for their parents, I can direct them to resources. Not everybody's in a situation where they can afford someone like me. And but the information is still really valuable to have, and it's not impossible to do. And it's especially important now that you gather up certain kinds of information so that you are prepared. Chances are, we have this little hurricane almost this weekend, and I put down my shutters and I said to everybody, thank me that I put up my shutters because we didn't have a hurricane because I prepared, right? So, you may never have an emergency if you prepare. That's how you ought to think about it.
Right. And I will say that, a lot of times when a family member or a spouse or a parent passes, there's a lot of chaos. And of course, there's a lot of emotion going on. But if you are prepared ahead of time and you've had these conversations and you have your documents in place, it really takes a lot of that stress off. So there's a lot of conversations that are hard to start and you may not know how to start, but they're so important to have beforehand.
Yeah.
So important.
That peace of mind is just, it's invaluable. And
For everyone involved.
yeah,
Yes.
absolutely.
Absolutely.
Thank you very much for giving me this opportunity. I really enjoyed it, and yeah, and I can also say incredibly wonderful things about Shayne. I have used her in several situations, and she's just a tiger. So she's kind. She's a kind tiger.
Well, thank you, Carole, and thank you for being with us today. And thank you all for watching. And we hope you tune in next time, and we hope you learned something today. And again, if you'd like to reach out to Carole, I will include her contact information, and you can always reach out to me as well. Have a wonderful day, everybody. Bye-bye.
Hi. Thank you.